some other commonly used antifungal medications. And we do have table 5.5 on page 85 that covers several of these medications. One medication that is generally given IV for serious fungal infections that are in the body is a drug called amphotericin B, or Amphotericin. This is not a drug that is given lightly. It can be pretty nasty. In fact, the nickname for amphotericin B is amphoterrible. And it's given when somebody's got a really serious internal fungal infection. I took care of a patient one time who had a spinal fungal infection, and he was getting amphotericin B, and that is the one and only time I've given that in my in my entire career. I've only had to hang amphotericin B once, and it was a heavy-duty medication. It was infused. It had to be given in a sugar-based IV fluid as opposed to the normal saline he was getting the rest of the time. I had to keep a very close eye on this patient while he was getting it infused, and get a lot of vital signs as it was hanging. And it's a pretty nasty medication, but very effective if needed. On page 85, another drug is covered, griseofulvin. This is another commonly used drug, and it goes by the nickname Grizz. And you can see on page 85 that they'll call it Gryfulvin or Grispeg. And it comes in various doses depending on what kind of fungal infection the person has. The activity of griseofulvin will be decreased if you've got a patient taking barbiturates. So if you have a patient on phenobarbital for seizures, he or she might need a higher dose of griseofulvin because barbiturates can interfere with that. A very commonly given drug for a variety of mixed bacterial and fungal infections is a drug called metronidazole. There again, you see azole. When you see a drug ending in azole, you know it's a antifungal. The trade name of this is Flagyl. This drug interacts with alcohol very, very badly. It has a disulfiram reaction, so you do not want your patients taking Flagyl to be exposed to alcohol. They shouldn't have it for 24 hours before they start the drug, and they should not have it for at least 72 hours after they stop taking the drug. Metronidazole in their system combined with alcohol, they are going to be sick. Now, I mentioned drugs that end in azole, azoles. They alter the cell membrane of the fungus by depleting something called egosterol. And if they don't have this egosterol, it won't allow the fungus to reproduce. So I talked about fluconazole, ketoconazole, metronidazole. They all alter the cell membrane, so they do not allow the cell to reproduce. So it's fungistatic. When it comes to antifungal medications, we want to take all the medications as ordered, just the way we recommend our students or our patients to do for antibiotics. Remember, rule 1 for antibiotics: they don't work on viruses. Rule number 2, take them all till they disappear, or till the symptoms, take them all till they're all gone. Don't stop when symptoms disappear. And this is true of antifungal drugs too. If a person is on steroids, especially chronic steroids, and they're taking antifungals, they can end up with a superinfection, usually of yeast. Antifungals, all our patients should avoid alcohol. We want to report nausea, vomiting, and diarrhea. Those are the most common adverse reactions to antifungals, and it might be unpleasant enough for the person to want to stop taking this. So they need to report that to their healthcare provider. Patients should also be told to watch for easy bruising, sore throat, rash, and fever, as the antifungals can work on their blood cells, liver, most of the time they don't cause any problem. But some of the drugs require keeping a close eye on liver enzymes because they can do some damage. If you are giving nystatin in a liquid form, like a swish and swallow, you especially have to shake it. Shake it very thoroughly before you use it on your patient. Griseofulvin, which we mentioned before, can cause photosensitivity, so our patients taking that have to be told to cover up when they go in the sun, wear a hat, wear sunscreen. One thing you want to do is take griseofulvin with fatty meals. They are absorbed a lot more easily with a meal that has fat in it. So, tell them to sit down and eat their bacon and eggs and take their griseofulvin there. Sit down and take it at lunch with a nice bacon cheeseburger. It's going to absorb better. Ketoconazole requires an acidic environment to absorb better. So sometimes it helps to give this particular drug with a type of acidic juice or Coca-Cola. Soft drinks tend to be acidic, so that helps absorption too. If our patients have skin conditions and skin rashes like various ringworm, the fungus of the feet, athlete's foot, it's going to be very itchy and they're going to scratch. So it helps to try to keep their hair clean, their skin washed regularly, and cutting their nails and cleaning regularly under their nails can help prevent it from spreading to other parts of the body.